Good morning. First of all, thank you, Clayton, for having me on the call this morning. Many industries are doing these types of meetings, and I'm glad that you guys have come together to discuss this virus and what it's doing to our communities and to our country, quite frankly. And my motivation today is to give you some insight as to what can be done, what should we be looking out for in order to reduce the risk of contamination, and hopefully help the country slow that curve down, so that our medical facilities can keep up with the demand that they will undoubtedly face. So from a janitorial standpoint, we are telling everyone to please.
Did we lose Victor? Can anybody else hear me?
I think we lost Victor, Clayton.
I think we have. Victor, you still there?
I got a notification saying.
Yes, I'm here.
Oh, there we go.
Sorry about that. Anyways, so from what we're telling all of our customers and anyone that wants to speak to us is we definitely need to follow the guidelines from the CDC and the World Health Organizations. The washing of the hands extremely important. We should make sure that everybody in all of our facilities are washing their hands for a minimum with soap for a minimum of 20 seconds. Best next thing, let's make sure that we're using hand sanitizer if we can't get to a sink right away. Now, I know that supplies are limited out there as far as hand sanitizing is concerned. From what we're hearing is not that the hand sanitizer is not available or Purell, a company like Purell is not manufacturing it. The problem is that they don't have anything to put it in. Most of their containers come from China, and of course China is on lockdown and they're not really sending anything out, and if they are, it's very sporadic. So that's the big issue with the supply chain as far as sanitizing hand sanitizer is concerned. Now, somebody has asked me, can we make hand sanitizers at home? Well, hand sanitizers, basically the two active ingredients is aloe vera and alcohol. As long as you have a mixture of 60% or greater of alcohol, you can put some aloe vera and mix it with aloe vera, and you can have a pretty decent sanitizer right in your, you can make that at home. Now, we're not recommending that. We're just saying that in worst case scenario, if you need to do something, that is a formula to do it. We're requesting everybody to keep their social distance. I don't like the word social distance. I prefer to call it physical distance, because at the end of the day, we still need to be social with each other. We still need to talk with each other. We still need to interact as a community, because, for our mental health, right? We can't, go into and stick our heads in the ground and say, let this pass. So physical distancing is what, really needs to happen, 6 foot or more. Why is that important? Because this virus tends to spread out a little bit further than the normal influenza virus. Influenza virus is when you cough or you sneeze, it goes out about 3 feet. This virus goes out 6 feet. So that's the minimum required distance that the CDC is saying that we should keep amongst ourselves. To keep your hands away from your eyes, away from your nose, away from your mouth, so that you can avoid, contaminating yourself or contracting the virus if you've touched a contaminated surface. And if you're sick, if you have a temperature of 100.4 degrees or more, please, stay home till that temperature drops, or you're diagnosed with one other form of influenza or whatever the case may be. But we should take precautions. Tell our employees that if they're feeling, if they're symptomatic, to please rather keep them home for a little bit, and when they're feeling better, then you can bring them back in. Now, from a practical standpoint, and I've spoken with many of you in regards to your facilities, whether somebody has been infected or not infected, and some of you have requested disinfecting services for your facilities. So one of the things that I want to make sure that we all understand and that you understand is how should you assess the risk? Okay, whenever you're reaching out to a commercial cleaning company, in order for them to come and disinfect your facility, you need to be comfortable, feel comfortable that they're taking the proper steps and doing the proper things in order to give you a product that will reduce the risk of somebody being contaminated at your facility. Okay, a lot of people out there, and this is, and, a lot of the people are panicking and they're grabbing, this person, that person, this company, that company. But are those companies well equipped with the personal protective equipment, with the proper EPA approved chemicals, hospital grade EPA approved chemicals? And do they have a cleaning methodology as far as disinfecting the facility is concerned? So those are important factors when you're speaking to a commercial cleaning company to come in and disinfect your facility. A company that knows what they're doing will come out and say, we need to assess the risk, all right? Because you don't want somebody just to say, hey, I'm going to quote you this, and we're going to come and disinfect your facility. Well, you need to know the when, the how, right, and what, and the what, okay? So a risk assessment is extremely important. If you are at a low risk, you should not have to, bear the burden of paying a very high price to disinfect a facility if you're low risk. If you're high risk, meaning that you have somebody that has visited your establishment or one of the employees that have tested positive for the COVID-19, then you should be at a different level of disinfecting, right? So what we have done is we have done our own risk assessment program for all of our clients and potential clients. So when we come out to your facility, we're going to go through a systematic process which will yield a risk assessment. And based on that risk assessment is the recommendation that we're going to give to you on what level of cleanliness you need for your facility. So really quickly, those three levels are the low risk factor, moderate risk factor, and high risk factor. Right? And your low risk factor, meaning that, once we look at your facility and we speak with you and you've not had a case, you haven't had anybody that's been sick or that have been symptomatic or anything like that, then what we recommend is a deep clean of the facility, just to start with clean surfaces everywhere, right? And using an EPA approved disinfecting chemical, right? But that clean is basically a deep clean of the facility because, to disinfect, you first got to start with a clean facility. We need to understand what the difference is between cleaning and disinfecting. Cleaning, you're just wiping. You're wiping areas clean so they look good, right? They don't have any stains. They don't have any coffee rings. They don't, you're vacuuming the floor so there's no trash or debris on the floor. You're mopping the floor so they look nice and even. So that's cleaning. Disinfecting is actually using the proper chemical and proper dwell time, and what that means is that the time that the chemical sits on the surface in order to kill the bacteria or virus, right? Cleaning does not kill bacteria or virus. I want everybody to understand that. If you have a cleaning company and they come to you and tell you, well, we're disinfecting every day, we're doing this, we're doing that, unless they're using EPA grade or approved chemicals, and they're allowing the dwell time or the wet time on those particular surfaces, they're not disinfecting. All right. The minimum dwell time for fast acting agents is 3 to 4 minutes. Okay. You can find those dwell times on the manufacturer's label. When you're looking at disinfecting, it will tell you what the dwell time is for that particular chemical. Some chemicals, 3 to 4 minutes. Some chemicals are 5 to 7 minutes. Some chemicals are 9 minutes or above. So depending on the chemical that your company is using, that's how much time that chemical needs to sit on those surfaces in order to disinfect properly. So big difference between cleaning, which is just wiping clean, or disinfecting, which is where you have to keep the surfaces moist for an extended period of time using a hospital grade disinfectant so that the bacteria and the viruses are killed. So can you disinfect a non-clean facility? Well, we do not recommend that. We recommend that the facility gets clean first and then go back through with the cleaning, the disinfecting program. So at a moderate risk, right? Moderate risk meaning, well, maybe we have had some people that have walked through our doors. We can't be sure, right? We have some employees that went home sick, but they have not yet been diagnosed with the virus, right? So those are telltale signs that you may have been infected with the virus. So then it becomes a moderate risk, right? So in the moderate risk, what we do is we come in with the EPA approved chemicals, but now our staff, for the protection of our staff and for the protection of your staff and your customers, we will down protective gear. Okay, so we will use a gown, we will use a face shield, we will use eye protection and gloves. Okay, but that's the extent of the PPE because we really are not sure whether you are truly infected or not. We will go through and we'll disinfect the whole facility. We'll do a deep clean, and then we'll get into more of the areas where we normally would not get into, like, for example, underneath your chair rail or handrail, right, on your chair. Normally, those are touch points. And if you're not disinfecting the bottom of that, you're really not disinfecting that chair. Then you get into the high risk category, right, which is the ones that, hey, we have a confirmed case in our facility. It's either an employee or it's a customer, it's a member that came to our club and spent some time in our club, and they've reported that they were infected while they were in our club. Excuse me. At that point in time, we will go in full mode disinfecting. And what that means is that our staff will not even will not enter the facility until they have proper protective equipment on. We will use a lot more chemical. We would hit many more areas. We would also require that floor work be done. For example, we need to scrub hard surface floors. We don't need to strip and wax them, but we definitely would need to scrub those with a quad disinfectant in order to kill the viruses on the floor. We would have to extract your carpets to make sure that whatever is living on your carpets, we're able to remove. So that's the biggest thing with a high risk, is that floor work has to be completed, and proper PPE for our staff needs to be done. Now, we are in the process of securing some electrostatic sprayers. Let's talk a little bit about the myth of electrostatic sprayers. Electrostatic sprayers, the only advantage to electrostatic sprayers, which you hear a lot about in the market out there today, is that they mist surfaces much even better. It's a better spray. In other words, they cover the surfaces more evenly. Okay, but that doesn't mean that they're killing more. All right, the chemicals was going to do the killing, whether you put the chemical in a sprayer or you put it in an electrostatic machine. Okay, that's the only difference. It's just the mist that goes out and spreads the surface a little bit more evenly. People are charging more for those electrostatic sprayers because you can get into cracks and crevices that otherwise you couldn't get into. So, is that a better clean? We're not sure. I mean, what we're doing right now, the regions that don't have electrostatic sprayers, we are doing manual cleaning, which to me makes sure that you get every single area and you're just not trying to spray something and move on. So, to wrap this up, and then we'll open this for questions and answers, make sure that you're getting a risk assessment done at your facility prior to committing to any disinfection at your facility. You need to know where you're at on that scale. And if you have a company that doesn't understand or doesn't know how to do a risk assessment, then you have some conversations with them and explain to them what it is that you're looking for, and hopefully they'll be able to help you. If not, you can always call us and we can try to help you through that process, even if you don't secure us to complete your cleaning. Make sure that the company has a methodology, exactly what it is that they're going to be doing, and that they have a scope of work that can physically be handed to you so that you can see exactly what they're doing in your facilities. So with that, Clayton, are there any questions that I can answer?
Yeah, thanks, Victor. Thanks for that information. I know that's helpful. Does anybody have, like Victor said, some specific questions that you have about your facility or what you should be doing? Now's a good time to hit Victor with it.
Has anybody done the spray as of yet?
We have not done any of the spray. Like I said, the sprayers are way in back order. I mean, the demand on them were too big. But what we have come in and we've substituted the sprayer, I mean, the electrostatic sprayer with actual pump sprayers, which basically does the same thing. So yes, we have used sprayers.
Hey, Victor, Johnny Bridgman, Brentwood. We used a electrostatic sprayer. What's the life of that? Is that just an instant kill, and then you're still open for the virus to be re-implanted in your facility if somebody comes in infected, or is there some kind of a day or two lasting effect?
Well, to answer your first question, nothing is an instant killer. Again, when I was talking about the dwell time, even with the sprayers, you've got to keep the area moist for at least 4 minutes, if, depending on what the chemical reaction is. So nothing is an instant kill. The second question is, how long, or will you go back and become infected? Absolutely. The chemicals only work, and sit on surfaces for about a 24-hour period. After a 24-hour period, if you have somebody that walks into your facility that's infected and touches that surface, you're back to square one. And you would have to, go through that process again. So it doesn't take long for that chemical to sit there. What it does is it starts you from zero. When you do the disinfect, it starts you from zero, and now you can, implement some better practices. You can start really watching and working with your staff and club members to, follow proper hygiene procedures from that point on. So it just gives you a starting point that you can feel good about. But again, 24 hours later, you're going to be susceptible to anything that is out there. Now, talking about 24 hours, this is also important. When you are in the high risk category, please understand that you're going to be asked to close your facility down for 24 hours prior to disinfecting. The reason for that is, the virus lives in the air for that amount of time, and the risk for further contamination or contraction of the virus reduces after 24 hours of it just sitting there. So not that it's going to go away in 24 hours, but at least the risk, minimizes for the workers that are going to come in to try to disinfect your facility.
Perfect. Thank you.
Mm-hmm.
Anybody else have a question for Victor? All right. Well, Victor, thanks for being here today, and thanks for helping us out with it. I know that was some valuable information and probably answered a number of questions that our members have about their facilities. So thanks for your time today.
My pleasure. And again, we're here to help you guys. Just, give us a call if you need assistance, or if you have any questions that you may be unsure of that people are telling you. We're here to support the PGA any way we can. So thank you so much for having me today.
Thanks, Victor.
Thanks, Victor.
All right. Bye-bye.
All right. Next